All right, welcome everyone to our live conversation, the third and final Practice Academy for 2021, putting the pieces together, harnessing the power of parenting time to strengthen the parent-child relationship and support reunification efforts in your family treatment court. Before I begin, and especially just one day after Indigenous Peoples Day, I would like to acknowledge the land and the people of the land I am on. I am currently on the ancestral lands of the Niitsi, Tape, Apsaluke, Cheyenne, and Oche-Tishakoin peoples in Billings, Montana. I recognize that these people are caretakers of the land in the past, present, and future, and that I will do my part to honor their land, their home. I commit to teaching my children about Native American culture through personal relationships, as well as attending local powwows and other cultural events. So this series is culminating today with this final session, harnessing the power of parenting time to strengthen the parent-child relationship and support reunification efforts in your family treatment court. I think this is the perfect culmination of the series. We started off with talking about how we facilitate our staffing and court sessions. And then in the next session, we talked about language and stigma. Having it come back around to parenting time, really facilitating that positive parenting time is the perfect ending, I think, because our staffing, if we're really family-centered, a lot of what we're discussing really is that parenting time or that family time. And again, with stigma, with language, how we speak about our parenting time, how we speak about our parents matters so much. And so that's why one of the reasons that we're going to be referring to this time as family time or parenting time rather than visitation. Parents don't visit their kids and kids don't visit their parents. We visit a doctor or a dentist. Your in-laws might come for a visit, but parents and children don't visit each other. They have their parenting time. So this is going to be a great conversation with some excellent panelists with a variety of experience and expertise, including at the research, program development, clinical, and practice levels. So before we jump into things, we want to recognize that September was National Recovery Month. So we'd love to have people share in the chat some of the different things that they did to celebrate that month. So we'd love to see in the chat if there's anything that you did to celebrate National Recovery Month with the families that you serve. Not seeing any yet. I'm sure that with COVID, with the ups and downs of how things have been, reopening and closing and different things, that might have been a challenge, but hopefully we found some ways. Looks like they organized a festival in Atlantic, Iowa. That sounds awesome. Awesome recovery bingo on Zoom. Painted rocks to place around the downtown area. A recovery rally. Workshops with the youth, different incentives. Oh, a softball game. I love that. We've had one of those in the court that I've worked with, and that's a really great time. Okay, finding different ways to appreciate different members in the group. A lot of really great ideas. That's exciting to hear about those. Thank you. Feel free to continue sharing in the chat. We'd love to hear about the different things and have you all share with your peers different things that have been successful. So we have those opportunities to learn from our peers. So thank you for participating. My name is Will Blakely. I'm going to be the host for this conversation. I'm a program associate for the Center for Children and Family Futures. Prior to this experience, I have served as a family treatment court coordinator, ran a father engagement grants, and worked as a child protection worker. Prior to that, I also served as a high school history teacher. So I've had a number of different experiences and worked very closely at different levels with parenting time, supervising them myself. And I think we're going to talk a little bit later on about how, what I think I did was really supervising it and how what we can be doing really is facilitating it. So I'm excited to get into that conversation and really talk about ways that we can all grow together. So thank you for being here. So the Children and Family Futures mission is to strive to prevent child abuse and neglect while improving safety, permanency, well-being, and recovery outcomes with equity for all children, parents, and families affected by trauma, substance use, and mental health disorders. This is a really, I love this mission because it really talks about the different goals that both family treatment courts have. It also talks specifically about what child welfare, substance use disorders, it really comes down to that collaborative effort. It includes all those unique pieces to really help families heal and be healthy. So we are supported by the Office of Juvenile Justice and Delinquency Prevention. OJTDP has funded the Family Drug Court Training and Technical Assistance Program since 2009. We're really excited to be able to be a part of this work, but we also recognize that the work that we do with family drug courts or family treatment courts is just one piece. The Center for Children and Family Futures offers a number of different training and technical assistance programs, working really at that intersection of substance use disorder treatment and the child welfare system and the courts. So we're very excited to join you all today to have this conversation. And we want to thank and acknowledge the Office of Juvenile Justice and Delinquency Prevention for their support in providing this presentation, as well as all the different trainings that we offer and support that we offer to local practitioners and state level practitioners. And want to recognize that what we share in this presentation is not necessarily the opinions and findings of the Office of Juvenile Justice and Delinquency Prevention, but those of the panelists and our staff. Since 2013, the Family Drug Court TTA program, or Training and Technical Assistance Program, has hosted the Family Treatment Court Learning Academy, bringing teams relevant research information, practice examples to respond to emergent issues in the field. This year, the language has shifted a little bit because, again, we talked previously about the importance of language. We shifted from the Learning Academy to the Practice Academy because we're recognizing that in order to improve outcomes for family, it really requires a change in practice and not just learning. So that's why we share there at the bottom, learn, share, do. And so we're going to talk a little bit more about how we're able to kind of put those pieces together and experience the different elements of hearing from our experts in the panel, and then being able to take that and share with our team. And then what are we going to actually do about it? So we're going to talk a little bit more about that later. So again, we mentioned each of these different sessions, but we encourage you to check out our website at cffutures.org/FTC-Practice Academy in order to find both the live conversation like what we're having right now, as well as those animated videos and those discussion tools and take action tools. So a lot of really helpful pieces in order to really get the most out of the session. So this topic, this Practice Academy course discusses quality parenting time, as well as how to objectively measure and track progress in strengthening the parent-child relationship to support the family and inform decisions about parenting time expansion and reunification. Family treatment courts teams have the opportunity and the responsibility to encourage safe and frequent parent-child interactions that support bonding and attachment. We know that when children have been removed from their home due to safety concerns, frequent and quality family time during this period of out-of-home care has been shown to be a critical factor in achieving timely reunification. When a substance use disorder is present, ensuring regular contact between a parent and the child or children while concurrently providing treatment is necessary to ensure that the parent-child bond is maintained and strengthened. In addition, this is an opportunity to help build parenting skills that can help reduce the stress and increase the confidence and competence so that the safety and well-being of all family members is assured. Family treatment courts are in a unique position to support this process. So we think that this is so significant to the work that we're doing because parenting is such a vital piece of child welfare cases and also family treatment court cases. It's not something that we as a field have generally done a great job with. Like I mentioned, I've supervised those parenting times, and I think that if I'd had some of this information that we're getting ready to hear from our panel, some of the tools, some of those discussions that we've had and are going to continue to have, we could do a better job. Like many of the topics we discussed, supporting parents with substance use disorders is the best way we can, is really going to require a paradigm shift. So what we'd like to do now is have people share in the chat, and I think we've had great chat participation already, but we'd like to hear from you all. What is something that you believed earlier in your career about parents with substance use disorders or about providing quality parenting time that you think about differently now? So what's something in your thinking or in your experience that has changed since you started this work? Okay, so Jenny says that that a parent has to be testing negative to be able to be safe at parenting times. The belief that parents would choose drugs over their children. Kids are better off without their parents who are in active addiction. Understanding that relapse is a part of recovery. The difference between safety and risk. That there's not just bad parents who don't care about their kids. There are people who struggle through unfortunate circumstances who are doing their best. Oh, that's a big one. I believe that I shouldn't work harder than my clients. All right, that we're building to become more trauma informed now, realizing that change is possible. Yeah, if we didn't, this would be hard work to be in if we didn't believe change was possible. Absolutely. Lots of great participation. Thank you. And we encourage you to continue adding to that. So I've been thinking a lot about this topic of really working on enhancing this parenting time, really talking about different ways that we can gauge this. And just this past weekend, I spent a couple of hours Saturday evening with my 6-month-old and my wife at the emergency room. My daughter has RSV. And as I was in there, I was thinking about how everyone from the staff at the entry point to the nurses to the different therapists that we work with and the doctors, everyone around us in this entire system was there to help support my wife and me for being the best for our child and really being able to support being both for her health as well as for us as parents. And I just thought a lot about in that moment. I was sitting there thinking about how, man, what if we could really make parenting time? What if family treatment courts would feel like this for our parents? That when you walk in the door, every person there is saying, how can we help you? What's going on? Tell us. We're not here to judge you. We're here to support you and really walk through what's going on in order to best help your family heal and be healthy. And so specifically, that's something that I was thinking about the other night. But then, like I've mentioned, I also in my professional experience have sometimes not provided the best parenting support for families and really wanting to be able to walk through supporting this work for all the families that we work with. So also on this page, we just want to mention that there's a couple of great resources that work hand in hand with this live conversation that we're having. There's an animated video featuring Dr. Katz as she provides meaningful insight into quality parenting time. A couple of the highlights that I wanted to just mention that I took away in that video is that this is an opportunity and a responsibility for family treatment courts to really offer the best, highest quality parenting time with the highest frequency that we can for children and families. This is something that we really want to hit on, is that this work is not just for child welfare and other parenting agencies, but it involves everyone in the family treatment court. So it involves the judge asking questions, the attorneys being able to participate in these different conversations, and really it includes the entire team. So we're excited that we have a lot of people joining us from those different roles. One of the pieces that I really thought a lot about was how we can use definitions, expectations, observations, and facilitation to inform a case plan, which can pave the way to reunification, and really making sure that everything is as clear, that parents know exactly what is expected of them is so key. The video also reminded us that we all come into these parenting times, come into our family treatment courts, come into these different environments with set attitudes, beliefs, practices, and expectations. and how those expectations and those other pieces interact with those of the parents that we serve in the midst of their interacting with their kids' personalities, feelings, and needs. The video also offers practical tools for observing and reporting on parenting time, highlighting the intersection of parenting time, stigma, and court staffing, which again kind of goes back to the themes of our 3 different Practice Academy sessions. Also included is a team discussion tool, which has some questions for debriefing the video, setting the stage for meaningful parenting time questions, tools for observing and tracking progress and needs in the parent-child relationship, and opportunities for sharing quality, objective information to guide decision-making. Additionally, there's that take action tool, which includes practical next step guidance, specifically related to prioritizing topics, information sharing, tools, checklists, and decision-making processes and monitoring tools. On the website, we also have a number of different supplemental resources, including publications, actual tools, and a number of different things. So we encourage you to check that out. We will be offering a certificate of attendance to everyone participating. I think I saw this in the chat already, but we will be sharing that in the chat at the end of the session. So please download that certificate from the chat if you would like one at the end of the session. All right, so a little bit about how today is going to work. We're going to have a facilitated discussion with the panelists based on the questions that you all submitted with your registration. That's going to be about 50 minutes. Then we are going to have an opportunity for a question and answer. So we would encourage you to continue participating in the chat. That's going great. We really appreciate your participation. We also are going to have an opportunity for you all to, throughout our discussion today, add questions into that question and answer box. If there's a question that you really like that you want to make sure that we get to, there is an opportunity to vote that question up by clicking the thumbs up icon in that question and answer box on the questions that you want to make sure that we get to. As a reminder, we're also going to be posting the recording, the chat box, the resources, and the question and answers on the Practice Academy webpage after the event in the next week or so. So that's a little bit of the logistics. And if you have any other questions, feel free to drop those in the chat. We'll continue to be able to respond to that. We have a great team kind of in the background offering all the support and making sure that we get to everything, all the questions that you guys have. And just really appreciative to everybody in the background, especially Tessa Richter, who has kind of put together this whole Practice Academy series. So thank you to our entire team. And then next, I'm excited to introduce our amazing panel of experts, like I said. So I'm going to invite them to go ahead and introduce themselves, but we're just really excited to have Dr. Lynn Katz, Laura Orlando, and Samantha Bond joining with us today. So I'm going to ask them to share with us just a quick 2 to 3 minute intro of their name, their role, or their agency that they work with, and then some sort of anecdote or some sort of explanation of why they care about this topic. So Dr. Katz, I think we'll start with you. And it looks like you're on mute still.
The basics.
There you go.
Okay, good afternoon, everybody. Okay, in a nutshell, I've spent, as of this past year, 30 years working at an early intervention program for babies born prenatally drug exposed at the University of Miami. As a researcher, a service provider, and part of the implementation research team across the disciplines in our juvenile court to create evidence-based parenting time, to examine what we were doing and to move forward to give the best options to our families. I'd like to share a quick anecdote which talks a little bit about the past. And when I say the past, some of you maybe weren't born. That's how long I've been doing this. We all worked in our silos. Is that news to everybody? And so early interventionists, we worked directly with treatment providers, getting referrals for babies who had tested positive at birth for being prenatally exposed. So we were in our silo. And then one day I got a subpoena from the juvenile court asking me to come to court and talk about the progress of the child in our program. I think what's important here is that I had no idea that these children were connected to child welfare. I was in my silo. I had no idea why I was being subpoenaed. And I had a vision of some of those courtroom dramas on TV. And I very hesitantly went to court. The judge asked me to approach the bench. I was sworn in, and I gave her a report on the developmental progress of the child. I also talked about what the interactions look like between both parents and etc. And the judge said to me, "Look what I have for parenting time. I have a certificate of attendance. Let me take a moment," she said, "and ask mom, what have you learned in the course of participating with your children in parenting time?" And what was really sad for me to see was that, given the setting and given the questioning from the judge, mom couldn't come up with a single thing she had learned from her participation with her children and with a facilitator in parenting time. I said to the judge, we can change this. We can be more family centered. We can come up with a change. She said, "Approach the bench." So I walked up to the bench. She said to the sidebar, "Let's have lunch." And that was the beginning 25 years ago of the juvenile court, child welfare coming to the table to say parenting time can be better. It can be family centered and moving forward. And for me, that changed what we were doing, and we became partners with child welfare and all of the other folks who help families move towards reunification.
Great, thank you. Yeah, it's so exciting to hear how those things get started. So thanks so much for being here, Dr. Katz. Next, we'll go over to you, Laura, if you'd be willing to introduce yourself.
Sure. Good morning and good afternoon. I am Laura Orlando. I use she, her pronouns, and I am the Strive Project Director. And I work at Partners for Our Children, which is affiliated with the School of Social Work at the University of Washington in Seattle. And I'd just like to take a moment to express my gratitude to the Coast Salish peoples on whose land I live and work. For me, I've always been incredibly passionate about parenting. I worked for Head Start for a number of years back in the day, but really what shifted my thinking about parenting time was actually back in 2009 during the H1N1 outbreak, when we thought that was what originally we thought was a pandemic. And I happened to walk by a visitation room, and I noted a parent in the room in which there was just a couch, a table, a couple of chairs, a person on a laptop typing, and a mom with about a 2-year-old with a crayon. And I was like, what's going on? And then I kind of asked, and they said, well, we had to kind of clear out the space of all of the toys and stuffies and different things because of the H1N1 crisis, and we don't have people to clean and sanitize between. But it literally just left me thinking, what does this look like on a daily basis for parents coming into these spaces? And what do we think are the chances of succeeding for 2 hours with a crayon? Personally, when one of my daughters was that age, I wouldn't have made it probably 10 minutes without wanting to leave that room really quickly. And just kind of holding that moment and thinking more about parenting time, and just really realizing it's such a powerful, it can be a powerful time for parents and children. And how do we support them in that space and time? And so, yeah, and I'll talk a little more about what that led me to.
Great, thanks. Yeah, I think a lot of us have seen that room or even been in that room. So very excited to kind of hear about some of the ways that we can shift those practices. All right, Samantha, over to you. Would you be willing to introduce yourself for us?
Hi, everyone. My name is Samantha Bond, and I'm a program manager here at our local mental health authority, Integral Care, here in beautiful Austin, Texas. It's nice to be here with everyone. So I've been a therapist for a long time, but when I first got into the field and I was still figuring out what the heck do I want to do in this mental health world, one of my professors during my undergraduate had suggested to me that I look into doing, being a supervisor and what I would now refer to as, this parenting time and facilitating that. And it was a very eye-opening experience for me. I had never been involved in it before. And what I saw was very similar to what Laura just shared, of a very, sterile environment. The, kid and parent were just kind of sitting there. And I got to talking to this particular mom, and she told me, I don't know how to play with my child. So, what I had been trained to do as this green, clinician was play as you normally would with your child. And she looked at me with tears in her eyes and told me, I don't know how to do that. So it was very eye-opening to me, not yet being a parent myself, but realizing, wow, parenting is not this innate thing. Just like any other strength, we build it, right? And it really solidified my passion of working with systems and helping parents to learn how to be better parents and supporting them in that journey. So that was kind of my aha moment with this particular topic.
Great, thank you. And I see a handful of people have added their why also in the chat. So thank you again for participating. Again, want to just remind folks to continue participating in the chat, as well as adding questions to that question and answer box. And so with that, I think we'll just kind of jump right into things. So we'll start with a question for Laura, but then also invite everybody to participate in the conversation. What best practices or research guides your work?
Yeah, so to be honest, I think I'm most guided by those who have lived experience and who have been involved with the child welfare system and have somehow successfully navigated it, often without some of the resources, fortunately, that we have today. And just really hearing their stories about how stressful that time was for them, how traumatizing it was, and how they felt so judged. And so I just hold that as I think about my work and how can we improve that experience for them. Additionally, I really believe in kind of, I guess, the golden rule and just really treating people as you'd like to be treated, with dignity, respect, and kindness. And how do we create spaces that allow for that for families? And then in terms of the literature and research, just really look for anything related to parenting, particularly as it relates to those who are child welfare involved, stress in parenting, poverty, mental health, substance use issues. I think I said trauma, being trauma informed. And then also practices related to cultural humility. And then I would say in my work, particularly kind of a seminal or really important piece of literature was done by Johnson et al. In 2009. She's located at Berkeley. And it's called Assessing Parent Education Programs for Families Involved with Child Welfare Services. And in that, she did a kind of a scan of all of the parenting programs available for those involved with child welfare, and found that very few were really designed from the ground up for child welfare involved parents. They were kind of taken or adapted from other fields. And so none of them were, maybe they were like close to being highly relevant to these families, but I think that factors in when we think about why parents drop out of programs, why there's attrition and things like that. But then also, there wasn't at the time, and still, I mean, we're getting more data and more information and more evidence, but there wasn't any highly efficacious programs either. And so as we at Partners for Our Children started to think about designing a program, we really wanted to create something that was highly relevant to child welfare involved parents and their needs, as well as, over time building the efficacy for that the program actually helped people. And And another part of that article that actually honestly was very important to now how we, why we developed the STRIVE program the way that we did, was that she identified 5 areas or domains in which child welfare involved parents tend to struggle. And those are social cognitive processing, impulse control, parenting skills, social skills, and stress management. So while when we think about those domains, it's a little bit negative the way that we think about people struggling in those areas. So we created a program that built strengths in those areas or attended to those things in a strengths-based way. And then I'm fascinated by implementation science and why things get implemented and how things get implemented. Yeah.
If I can piggyback on that, Will, yes to everything that Laura just said. And I'd add some other variables to the basket in terms of best practices and what we attended to in Miami and across the state of Florida, because we were at the macro system level. We were telling a whole system of care, let's retool, let's make a paradigm switch. So in addition to the areas that Laura mentioned, which we needed to attend to, we also needed to be thinking about what children bring to the table and child development and the impact of separation and across different age ranges. What does that mean? We also needed to, we met with folks at the University of North Carolina. We talked to them about implementation research. How do you get started with a system-wide paradigm shift? And then we heavily relied on what we've learned clinically from folks like Alicia Lieberman, her violence project in California, a very famous handbook called Ghosts in the Nursery, which helped teach us what families bring to the table. That's a big part of their attitudes, beliefs, and practices when working with their children. And there was a seminal quote that we heard about early in our work. It sounds crazy, I'm just gonna say it. Selma Freiberg, a very famous clinician from decades ago, said, "There's no such thing as a baby." What do you mean there's no such thing as a baby? And what she went on to say is that young children and all children live and breathe in relationships. They do not exist as themselves. You know, we talk about nature versus nurture, which is it? But they become who they are based on those relationships. And so as we support parenting time, we're thinking, as Laura mentioned, and Sam as well, what are things from the perspective of the child? How do we speak for a baby in a parenting time session who cannot let a parent know how they're feeling about how they're being held or how they're being played with? And I think if you take all this information, all of these best practices, they belong in the hands of a team, a cross-disciplinary team. And so I would suggest that in any paradigm building or switching, that information from all of these fields be in some way presented to your system of care stakeholders. They need to know that they all have a responsibility. They bring information about treatment. They bring information about reduction of risk to the table, but they need to understand the plan. If you're going to build on what you're doing or you're going to move in a new direction, that's our homework. And I spoke about this a little in the video, Will. I talked about all of us on teams have a responsibility that shares with child welfare to understand we have something to contribute in every area of parenting time, whether it's discussions of levels of supervision, whether it's a discussion about maybe terminating parenting for a week or so because of something. Research tells us Any decisions we make need multiple measures from multiple perspectives if we are going to be equitable and fair working with family systems.
Great, thank you. And I think what you're saying there kind of leads right into our next question is, what are the key elements to consider in providing the best opportunity for quality family time? Specifically, what should be considered in determining the level of supervision needed for families? And Samantha, we'll start with you on this one.
So I think just to piggyback off something really important that has been said a couple times now, but something that I've realized in my time supervising the child and family therapist that I'm over in our drug court program is communication is key. And there's so many people that are trying to get to the same goal, right? We all want to make sure that for our kids and the parents that this parenting time is the best it can be. And so sometimes I think it's just making sure that some of these really basic things are being thought about ahead of time. One of the examples that I thought was really great that Dr. Katz incorporated into the video was talking about this dad that, you know, had 3 different age kids, but so many times with babies, we see that they don't have the basic things that the parent will need to soothe them, you know? I mean, for those of us that are parents, you know how hard it is to soothe a child, even in the best of circumstances, let alone in this, you know, controlled setting that we're doing parenting time in a lot. So making sure that we're setting up our parents for success with basic things like age appropriate toys, making sure that, you know, if they're going to have this 2-hour visit, that the kiddo can actually get through it comfortably, and the parent has the tools that they need that maybe they would have in a different type of setting. And also being mindful of setting the kid up for success with, are we thinking about nap times for younger kids? Sometimes because of, you know, just the chaos and the restraints that we have of just being able to find out who can even facilitate, how are the kids going to get there? How is, you know, mom or dad going to get there? There's so many factors at play. But if we don't take that step back to say, okay, is this the optimal time of day for the kid? Then we could just be setting up a parent for a really, you know, not a great session because the kid is just not in the right place. They're going to be fussy. Parent is going to be frustrated. So I think just thinking about a lot of really practical things like that before we even set a day and time for these visits is something myself and my staff always advocate for. Another thing is just what type of environment are we using? And I know that that's a really big limitation to a lot of programs. And sometimes we don't have a choice, you know, sometimes it really does have to be, you know, at the CPS office and there's no other option. We just had a really good visit with one of our families that has 3 young kids, and we were able to facilitate it at a park because it was beautiful weather. And just something simple like that made the parent and the kiddos feel way more comfortable, you know, and they had a great time because they weren't, you know, just kind of stuck in this room for their time together. And then the other thing that I wanted to touch on here is making sure that we're setting really clear expectations to the parents. A lot of times what my staff see when they kind of go out of their normal role as therapist and help facilitate, they try to do that as often as they can in my program, is that parents feel really defeated if the visit didn't go well, and their expectations may not really be realistic. You know, if we have maybe an older kid that has a lot of emotions towards their parents about, you know, the situation that they find themselves in, they may let that parent know, you know, and this visit that the parent has been looking forward to for all this time just goes totally the opposite way. And the parent feels upset, the kiddo feels upset. So really just supporting the parents and how they're feeling about the visit and taking that time to, you know, debrief with them, I think is really important as well as a team.
You know, Samantha, I think that speaks to the notion of the words that we talked about in the video: facilitation of parenting time versus supervision of parenting time. Supervision being the person who arranges it and is making sure it starts on time and ends on time and nothing is going wrong. But where can we all think about with our teams about facilitation? Because you brought up a really very good point. If in fact that teenager, along with the toddler that dad was dealing with in the video, starts acting up, you know, mouthing off to dad, that kind of thing, and dad is feeling helpless about how to respond, isn't there, or shouldn't there be, a role of an available facilitator who is able to guide, to be able to not let this degenerate into something where, as we said in that little scenario, now the baby is crying because dad is trying to focus on the teenager, and the 2-year-old is stamping their foot and trying to get out the door of the parenting time room. So I think it's important to talk about facilitation. Some degree, no matter what the setting, may be needed, particularly in the early stages of parenting time, to help over those hurdles, to be some guidance without being intrusive. And I'm wondering what you all think about that, because people shouldn't be left to their own devices to fail, and then someone taking notes and writing a report that it didn't go well, and the children go back home and everyone's upset, and grandma calls the child welfare worker and says, I don't think we should do this anymore. Everybody was upset. So there's a lot of learning that takes place in facilitation. What have you both done? Laura, what do you think about that in general?
Yeah, I definitely think that parents should be supported and teed up to be successful in this setting. And I think what I've really been thinking a lot about lately actually is trauma, and the level of trauma that exists in this group of families, and adverse childhood experiences, and the fact that by removing the child, we have created an ACE for that child, right? And so how do we think about becoming a trauma-informed system? And if we can't, I know we can't always control the way that a system does what it does, but how, as an individual, can we respond to families in a trauma-informed way? And so I think in the context of parenting time, I've been thinking about kind of a simplified model of how to be trauma-informed. And it's really, how do we create safety for the family and the child, physical safety? How are we trustworthy? Like, do we share the data that we're collecting about that parent? How do they know when they've been successful or when there's something they need to work on? Do we create clear and consistent boundaries? And is there predictability? And I know that it's a mandated service, but is there any way we can offer choice? So Samantha nicely has talked about, well, it was a beautiful day. We were able to go to the park. That's a simple way that we could offer choice to a family. How do we restore power? Through skill building. I think, right? Some of the, parents are, struggling with their parenting skills. Maybe they weren't parented well in the first place. And so how do we set them up to be successful in this context? And then really, I think what I talked about earlier is just build self-worth. How do we build relationship and respect for the parents, as well as compassion for all that they've gone through and are showing up and trying to become the parent they want to become? And so, yeah, I think those are a lot of the things I think about. And just generally the level of poverty, abject poverty in this group of parents, and how do we come together and not work in silos? And because child welfare can't offer housing, right? So how do we work with housing providers to help families receive housing? And how do we acknowledge that some of these parents might be showing up hungry? And can we have resources for them so that they can be bring their best selves to family time or parenting time? And then I know there's been some pilots related to transportation and using Uber and other vehicles for getting parents to their family time. And I think that's really important to consider with this group of parents. And I think that I think it was Tessa that put in the comment just about how we used to have this notion that the parent needs to be working as hard as we're working. And I just, I think for the benefit of the children, we all just need to put that aside and work together and support these families as best we can.
Agreed.
So as the team looks at everything going on with parenting time, how can teams incorporate the ranges of parenting styles, family strengths, cultural norms, protective factors, social supports when discussing a family's needs and the progress that they're making in order to ensure that they are offering and really setting the table for equitable opportunities for all families? Dr. Katz, we'll start with you for this question.
Which is not a simple one. I think we have to, I'll go back to what I said before. We have to have multiple perspectives from the total group of folks who are working with the family. We need multiple ways to measure. And we've talked about observational measures. We've talked about parents filling out questionnaires. We talk about the AAPI that so many of us are using, so that we can get a sense of, at the very beginning of a parent exploring their parenting time with their child, get a sense of their attitudes, beliefs, their current practices. What do they bring to the table in terms of how they are, how they'd like to parent, having those conversations and using the measures that are out there that allow for parents to self-report, then at the same time, sort of observing their practice over time with their children in the parenting sessions. And we like to use checklists that say, this is an emerging strength, as opposed to they don't have it, they can't do it. Yes, they can do it now. We like that gray area, which is what this is all about, is that progress over time, particularly in families that are parenting this child or these children sober for the very first time. It's exactly what Sam said before. I haven't played with my children. No one ever played with me. I don't know what that looked like, what I will expect. So there are measures. We don't have to invent the wheel, but we need lots of perspectives. For example, for our moms that are in residential treatment and they have their children with them, it's very important for us to know, what are people observing as they live together at the treatment, at the residential program? What are they observing in areas and constructs such as a very important one, which is empathy? Empathy is something we know that as empathy in a caregiver increases, the chance of harm decreases. And so many of our scales, like the AAPI and other observation tools, sort of help us quantify what empathy looks like in terms of responsiveness in an interaction with my toddler or my 5-year-old, and to be able to have data that shows whether that responsiveness, those nurturing behaviors are increasing. Because the other point I know all of us want to make is, if the parenting time is not going well, if it's not going well for one child, then it's time to back up and say, maybe we need to break up the parenting times. And maybe dad and his teenager need parenting time alone together, because that looks very differently, or with that crying baby, as Samantha said, that is hard to soothe, before we bring the sibling group in and expect the parent to be handling it all. So I think that over time, having data, then getting feedback from other people who are seeing the adults, the mom or the dad, or seeing them interacting, Those are broad staffing discussions in terms of where are we now? And then we bring in the word triage, which we talked about in the video. Sometimes clinical assistance is needed for one of the children, for the mom and all of her children. And so we have these auxiliary services that need to provide additional support, often clinical, rather than letting parenting time sessions continue to degrade if that's what's happening. We have to be attuned to that. I think it's really important.
Yeah, I think taking all those pieces into account, really looking at empathy. Samantha, I want to turn to you and ask you to tell us a little bit about kind of your role with the Family Treatment Court and who your client is. And then in addition to that, what strategies can be utilized to support the bond between the parent and the child or children?
Sure. So I manage the child and family therapist in our local drug court team. So basically what that means is the actual kid, no matter their age, whether they're 1 day or 16 years old, is our identified client. So the work that the therapists that I supervise do is we're looking from the child's worldview, of, okay, what does this kid need to be successful? And we have to be very creative sometimes when, we're working with our little itty bitties to make sure that we're helping empower these moms and dads to have a loving, bond, strengthen that attachment. So a lot of these assessments that Dr. Katz has mentioned, we do to kind of see where the parent is at. Because oftentimes, especially if we're dealing with maybe a first-time mom, we need to know, how do they even feel about being a parent, and sometimes we have moms and dads that feel really confident in their skills, and other times we have parents that don't even think that they can do it, and that's where a lot of these tools that we use really come into play, is figuring out, okay, where are you starting and where are you ending, and how can we best support you so we can support our client, our kiddo. So a lot of what my team does is really empower our parents. We want to show them that they do have every tool, and we're going to support them in every way possible to be successful. That's what we want for them. And part of how we do that is, Dr. Katz mentioned empathy, and I'm so glad that you mentioned that, because that was one of the words I really wanted to use a lot today, is we have to have that empathy. And empathy is one of those things that you have to learn sometimes, it's not this innate thing, and we have to learn how to be empathetic. And being a parent, being newly sober is hard. And it's understandable that a lot of our parents get frustrated with their kiddos. They get frustrated with all these things they have to do. And so a lot of times that translates into them just feeling like, why am I even trying? And we've had so many times where we've had to just give so much extra support to our parents to say, you got this, you're doing so great, and celebrating those small wins. That's what my team and I always talk about when we're supervising cases of maybe family time or family sessions that we're doing therapeutically that didn't go great. We had this one kiddo recently that it kind of became this big dramatic chaos of a session and a therapy session, but we were debriefing it with the mom, and we were still able to find some positive things. She would have reacted in a much different way in the past, and it showed how much she'd grown as a parent. And she's one of our parents that we had linked to parent coaching, and that's such a great tool that we can utilize for our parents to help support them. So yeah, it was really great to see that. Another thing I'll touch on before passing it on to Laura, Dr. Katz, is really making sure that we're validating the kids' feelings is important. And that can be hard, but that is going to help the parent and the child bond. you know, and just, I mentioned kind of debriefing with the parent earlier, but just preparing the kid and the parent to, you know, recognize your kid may be mad at you. Your kid may not understand what's going on and have questions. And how is that going to come out based on their, you know, stage of development?
Mm-hmm.
You know, a toddler may just start throwing a tantrum, or we had a kiddo the other day that was threatening to call the police on his mom's phone, and he couldn't understand what was going on. And mom didn't know how to handle that. And luckily the therapist was there to kind of help diffuse a bit. But you never know how kids are going to express their emotions, especially really, really big emotions. So just supporting both the kid and the parent through that is super important.
You said something really important, Sam, about being able to have those conversations and debriefing. Let me take it a step further. At the end of this parenting time, our teams are writing a report that will be oftentimes submitted to the court. And one of the best practices we've always found is to let the parent know what the report is going to say, in a way where, because then we go in person with our reports, our representative, the parenting time facilitator. So the forewarning and the discussion and the processing, it's easy to do the sessions that go really well and to point out and say, Your Honor, let Marie tell you about how the baby responded when she saw her. Those are good, but the ones like you're describing where there's more drama, that pre-court processing and seeing if mom or dad recognizes what their struggles and challenges were, and then standing beside them, literally in front of the judge and saying, I think that Marie would like to share some of her feelings, Your Honor, about what's included in this report. So you had that pre-court discussion. You've given, as you were saying, Laura, you've given strength and the ability for mom not to have someone speak about her from a report while she's standing there, which is so disrespectful and happens all the time in court. But for her to say she needs help, say that she tried, say that she knows she has some ideas for next time. If you have a trained judge who says, that's why training is so important across disciplines. I hear you, Marie. It sounds like you're making up your mind to learn what you can from the folks you're working with. And I'm sure that Thursday you will bring that modus to your next parenting time. And that's why those dialogues of support are so important. Rather than what we used to do is the parent did not do this. The child did not engage. Nobody should be doing reports like that anymore, or sort of blindsiding families about what we're going to be telling. And we always try to make it strength-based, like you said, find that something to build on and end the report with that hopefulness that we've identified something we can work on, and dad is very responsive to learning what to do. That's how we close the book on those reports.
I love that, Dr. Katz, and really ending on that high note, I think is so important. Really kind of giving parents that hope. I saw a comment in the chat about that as well. I want to shift just a little bit with kind of how the judge responds, how the parent is involved in that process. Besides how the judge responds, how else can teams use that information from parenting time reports to guide their decision making? And Laura, I'll start with you on this question.
I think that where I would start is kind of with the general assessment of the family, right? What are the risk factors that brought the child into care? What's the age of the child? what does the parent have going on? What are their needs? And how can these factors be mitigated in the context of parenting time? And then really, in the years I've been doing this work, it feels like the reports vary across the country, all the way from here in Washington State, where we have what we call Sprout, where people enter their reports into a system, it gets tabulated, the data can get analyzed. The issue there is like, are we capturing the right things? Are we measuring the right things that matter in this context? But then I've heard also that like some things are jotted on the back of a napkin, right? So I think we need to probably start there, some of these teams, and thinking about what data do you have available? What does your data look like? And in the context of that, holding race and ethnicity, and how does parenting time, the experience of parenting time differ depending on your race? Do you have access? Are families of color visiting less frequently? Do they have less access to their children? Are we helping them to access evidence-based programs if they're needed and things like that? Then I think that with the Strive program, because we've really struggled to find, kind of a codified tool that is looking at parenting in the context of family time or parenting time, we've developed an observation tool that looks at kind of 10 elements of what we think are kind of the hallmark of good parenting. I mean, not, again, we don't want to raise the bar on these parents, but we do want to have some type of bar that we're helping them to meet. And that, I guess, is another point. I would never want to just collect data without also giving support and really helping these parents to get where you're wanting them to go and sharing that information with them. So we look at things like, very basic, like, do they show up on, frequently? Do they show up on time? Do they bring or access needed items for that? Do they have a kind of a family time routine, or things like, do they greet their child? Do they have activities and things planned? And then the ever important, how do they say goodbye? Is there a routine related to that? But again, teaching, if a parent needs support in that, what is a family time routine? Why does it matter? What are the elements of it? Do you need help getting snacks or other things? Can they manage challenging behaviors in this context? Are they able to nurture their children? And we help define what we mean by that, because it needs to be, concrete and observable. For here in Washington State, we use a lot of contracted providers who are lay professionals. Samantha, your program sounds wonderful. I would love to have family time with you, but it's not always the case. A lot of folks are just there to really observe and ensure safety. And so, how do we create an environment where parents feel safe to ask questions or to say, I'm struggling here? I remember a story where a dad showed up to his parenting time and there was a diaper bag. He was new. He just realized he was dad. And there was baby food, a spoon, and a bib. And he's like, I think they want me to feed him. And, and because the Stride person was there, it was like, okay, let's have a, little mini lesson on how do you feed a baby? And and not write you up that you didn't know how to do that. Right. Anyways, I think that the data has to be held in the context of the service plan, as Dr. Katz mentioned. What are the other things that the parent needs to be working on and moving forward? So it's not just compliance, but really progress. And then how do we support the parent and use the data from their parenting time to determine what other parenting support they might need? Like, is there another evidence-based program that might better benefit them and match their needs to what is available? But then again, not to use the data in a punitive sense, but really to help promote change.
Great, thanks. And I think, Dr. Katz, you included some of those specific data collecting pieces and tools, as well as some of those parenting curriculum, both in the video as well as some of those other resources attached. So you can find those there. So thank you guys so much. That was some really great information. I think that we all thought of things a little bit differently. And I love the different perspectives that we have of kind of bringing. Samantha, you kind of have talked a little bit about that lens of what's in the best interest of the child. Dr. Katz really kind of looking holistically at the family, and Laura, to some degree, looking kind of from the parent perspective. So really appreciate all the insight that you all brought from those different lenses. Coming up now, we're going to shift gears into our open question and answer session. So we have a few great questions. We encourage anybody else that has any questions to go ahead and drop those into the question and answer box. But to start off, Laura, there's a question for you. Somebody would like for you to talk a little bit about the native adaptation of Strive in Washington.
Yeah, so we spent the last couple of years working with Cowlitz Tribal Health Services here in Seattle. They're with the Cowlitz Tribe. And we always intended to create adaptations of the Strive program that would be a better fit for different populations or communities. And so we spent 2 years working closely with that community to adapt the program for use with Native families. And actually ended up adding a 6th session. It's a 5-session program as it currently stands, and really culturally grounding all of the curricula. And so bringing storytelling in. But I think, honestly, and I saw some more questions related to culture and how do you honor and respect culture in the work. And we've made it that program would only be delivered by a Native facilitator, so that when the family comes in, they see someone that looks like them. Cowlitz Tribal Health is in the process of becoming a family time provider. And so families will be able to go into that space, which is beautiful, and hear Native music and see art that reflects their culture. And then also, how do we create safe spaces for the parents? And so Native culture just has very beautiful ways of doing that, including things like smudging, that would only be done with the Native providers. But it would allow families to actually light a match and put something on fire, right? And, wear in a DCYF office or something. Some of these things would not be okay. But I think when we think about our facilitators or those who supervise the family time, I think we really need to think about, how are they trained? How are they compensated? And what is their actual role? And then how do we encourage more facilitators of color that actually look like the parents, reflect the parents, and can respect their culture in that way.
Great, thank you. And there's a couple of other questions that really kind of talk about that cultural component. And so we'll just kind of open it up to everybody now. But what are the best practices for cultural intelligence and economic differences with different parenting programs?
I would say from the Miami perspective, we have large population of Haitian families who speak Creole, who are of different socioeconomic levels, from doctors to other careers. We also have a varied Hispanic population, no two being the same: Central America, Cuba, all different locations. I agree exactly with what Laura said. It is important to have culture brokers, to have people who can be in leadership, and to go out and find those people who can help with the facilitation of a lot of things in your agency, not just the parenting time. And one thing, again, I'm going to put on my science hat here. we cannot use all assessment tools for all different populations if in fact that tool has not, as we say in science, been normed and used to be effective with folks who speak Spanish or come from Central America. So we are also charged with the responsibility of having observation tools that understand the cultural context of a family and validate it. We also have to be sure that when we're giving out information, that our translations, because we always say, well, it's translated in Creole, it's translated in Spanish. Well, my husband is Haitian, and many a time he looks at these translations and says, this translation has nothing to do with what you're trying to say or what you're trying to capture. So I think that where those linguistic cultural brokers come in, whether it be tribal or whether it be across different cultures, they have to help us be appropriate, provide equitable assessments, expectations. It's what we need to do along with trauma informed. So actually, you know, if we were going to take little baby steps in terms of a process of we're a core team, it almost means taking a step back and saying, who's part of our team? And do we have team members who can be responsive to this wide cultural community that we live in? And we're forgetting one other thing. We need people informed on working with families with disabilities, because I want to say that very often we find that the parent who is seeking reunification may have developmental delays, may have motor delays. I worked with a family where mom and dad were both severely hearing impaired. They needed to be in parenting time with a facilitator who knew how to sign. Because I can't write a report about you signing to your children or you responding to your children if in fact you are a parent who is hearing impaired, unless someone is there to interpret. It's the same interpretation as if we were speaking another language. And in this situation, a judge realized the family had been done a disservice because that was the acknowledgement and accommodations were not being brought to the parenting time sessions or the report writing. And so the system of care had to back up and find a cadre of folks who could support these families to be successful. And this family was ultimately reunified.
That's great. That's a great story. Thank you. The other part of this question that I want to make sure we touch on, and I know Laura, you talked earlier about transportation and kind of other ways of supporting parents with some of those needs that they have in order to have a positive parenting time. But what other kind of things, other best practices are there for helping parents from different economic backgrounds with parenting? Or we've already answered that part. So if we don't have something to add, we can move on to the next question.
Well, I think there was a researcher or maybe just a practitioner, Donna Beagle, and she used to do trainings on kind of like the culture of poverty and like the language of poverty and understanding families that live in, you know, disadvantaged circumstances, and just how I think some of this comes down to training for folks who facilitate. You know, there could be anti-bias training, cultural sensitivity, cultural relevance kind of trainings, and there could also be training related to poverty. And how does that impact parenting, and how do we support families living in poverty?
Great, thank you. And then there's a question that asks about reducing instances of systemic shame. Every person on the team has their own past traumas. How do we take that into account as we're communicating about family time? How do we make sure that we're not adding to the shame or the trauma of both the parents and the children?
Chime in on this one. I think it really comes down to, we've been talking a lot about language, and I know there was a whole other presentation and conversation about that. But I think really making sure that the way that we're talking to our parents about those expectations and setting them up for success, they need to feel supported, like Will, I thought that was such a good example that you made of taking your little one, I hope she's feeling better, to the hospital, and from the first person to the last person you talk to, knowing I am in the place I need to be and I have the support I need from anyone here. And all of us in these big, amazing teams that we're coming from want the same thing. But I think so often parents, they may be scared to ask a question. I know a lot in our team, what we find is maybe a parent will feel comfortable with the child and family therapist, but doesn't feel comfortable with someone else on the team telling them the same thing or asking a certain question, and it can split, and maybe not everyone on the team is aware of the challenges or how we can best support the parents. So just going back to that idea of making sure we're all communicating and making sure we're on the same page, because every parent is going to have different needs, and every kiddo is going to have different needs.
Great, thank you. And then another question that we have, we kind of already answered the first part about bringing or understanding culture and kind of how that's a part of the parenting time. But the second part of the question I think is really interesting. It's what do we do if part of a parent's upbringing or their culture maybe contradicts with the treatment plan or best practices? How can there be a positive modification for everyone involved?
I think that's so important. I used to say, when someone comes across the border from another culture where they were raised with different parenting beliefs, it's a shame that we don't meet them, at the border when they come and say, you're stepping into a different society. First of all, here's the things that are allowable in this country and not allowable. We never do that for families. So there would be no reason for them to understand what they're being judged by or why that DCF worker called in an abuse report. They just don't understand it. One day I was in court and on this was a TPR hearing, and I had done my part. I had read my report, and they brought Dad in, and they brought him in. He was in an orange jumpsuit. He had shackles, and he was there to hear what was going to be determined in terms of the trial, the outcome. And they said, Dad, is there anything you'd like to say? And he said, I parented the way I was parented, and I'm fine. He said that. Despite his circumstance, despite where he was standing. And then he said, I'd like to speak to Dr. Katz if I can, because I had not advocated for reunification in all of our reports. Reunification, the child was going to have permanency with grandmother, where the baby had been from the beginning. He said, I'd like to speak to her. And he came towards me. And I have to tell you, I thought, what is he going to do to me? Because I have never really met him before. And I've said that I don't believe he should be reunified. And the one thing he said to me after I stopped sort of shaking was, I know you have my children's best interests at heart. which was very hard for him. But at the same time, he still was in a place where he didn't know what he had done that had helped bring the children into care. And how do we do that? You asked a big question, Will. I know many cultures have practices and beliefs that are different than what child welfare says is acceptable. How do you do that? How do you come up with a primer? And then once you say, I know that this is what you do if your child misbehaves at school, but it's not legal here. You have to have conversations and show concretely how alternatives can be effective, particularly if you're dealing with a parent whose accusations were about corporal punishment and they go, my dad hit me and I'm fine. I mean, having that conversation, and I bet you both have to do it, is about, let's try something else. Can we give it a go? Let's try the next time he does this. If it happens next time in parenting time, let's practice. You're going to hold yourself back. You're not going to reach out to grab him. You're going to say something like that. How do we do it? How do you all do it? Particularly when it's diametrically opposed to what the law allows in this country. In terms of, it's usually corporal punishment and other things related to behavior boundaries. Or it may be using derogative terms towards a child, not about his behavior, but about who he is. You're a bad boy, as opposed to, we don't hit people. We're nice to, how to fully affect this change takes longer than the timeline of a court case making decisions about permanency, unless we are very, very effective. We have to be effective, and we don't have a lot of time to be effective.
It's definitely a very, very tricky topic that I think probably a lot of us have run into over the course of our careers or will in the future. But unfortunately, we need to move on. It's hard to believe that our hour and a half is nearly up. We want to offer the opportunity for each of our panelists to share one or two sentences of advice that you would have for teams really wanting to dive into this work. They're all going to hopefully have that opportunity to dig into the discussion tool and the take action tool. But what advice would you have for them? We'll start with you, Dr. Katz.
Oh, gee. Basically 2 sentences. When you leave this webinar, take a deep breath. Take a deep breath. You made notes. You put some things aside. You have those tools. And decide when your team is ready to regroup. And then, because I work with babies, I say, you got to crawl before you can walk. You have to take baby steps. Maybe your first meeting is, where are we at? And do we feel that information we learned today resonates with us and we're already doing it? We might like to add this piece. We might like to think about changing the locations of some of our parenting time sessions. Pick a single doable piece of what was discussed today, and then start by validating what you are doing. See the glass as half full. The point of this discussion was not so you all feel overwhelmed or empty, but more that, hey, we're doing that. That makes sense. But hey, that's a good idea. And then figure out how your team can do their daily work on the school bus and still change the tires as the bus keeps moving.
Great. Thank you. Laura?
I keep thinking I'm becoming an elder and I should have more wisdom to share. But I think for me, first, I just really want to acknowledge all the hard work everyone's been doing over the last couple of years in basically impossible circumstances. And thank you for trying to help these very vulnerable families. I think I would, the team, I would expand what we mean by team and think about how we can have, cross collaborative partnerships with housing agencies, with food banks, with churches, with other folks in your community. And then, yeah, and take a look at the data and, you know, how do you feel like things are going? Where do you think are some low hanging fruit areas where you could make some improvements connected to your parenting time and supporting the parents? And maybe you already have groups like that. I hope you do. But that's where I would start.
Great, thanks. And Samantha?
Just to echo what Laura said, I think the main takeaway that I always have whenever I think about just the hard work that my team does and all of our teams do is we are doing some thankless work sometimes, but it's so important. Every single person that's here today is changing lives, and I don't say that lightly. So I think just remembering that even these small things, these small wins, like I was talking about earlier, can add up to be life-changing for these kids, for these parents, for these families. And, you know, that word empathy, I think, is important. We are all working under really hard circumstances. Being in our field is not easy right now. It has not been easy with the pre-pandemic, and it's definitely not made things any easier. I know a lot of people working under, you know, very difficult circumstances, and just remembering, you know, are we coming from that lens of empathy? Are we being patient? Because it can be hard, and we're all human at the end of the day.
Great, thank you. And now for just a few closing notes for us to all be aware of. But I again just want to thank our panelists. You guys were amazing, shared so much great insight. And I know I'm thinking differently about a lot of different things, and excited to hear what all of the people attending today have to take away and to begin implementing in their family treatment courts. And then I saw somebody had a question about that family time or parenting time versus visit. I think that's a great example of a low-hanging fruit of just changing how we're talking about things and really how we phrase things. So again, we just want to remind everybody that we had our live conversation. We also have that animated video, team discussion tool, take action tool, and all those other resources that we encourage you to take a look at. The recording of this video is also going to be available along with all the question and answers, the chat box, and a few other resources that we've shared with you. If you have any other questions, please reach out to us at Children and Family Futures at fdc@cffutures.org. Reminder that there's these 3 different great Practice Academy sessions that we've had this year. All those resources are available on our website. We're also looking forward to Practice Academy 2022. We encourage you to drop in the chat if there's any topics that you're specifically interested in working on with us or learning about next year. So please drop those in the chat. We have a number of different idea exchange events throughout the year. So be sure that you sign up for a listserv to be able to participate in the next one. If you'd like to be added to our listserv, please drop your email in the chat, or again, email us at fdc@cffutures.org and ask to be added to that. For anybody that is needing a certificate of attendance, that's being shared in the chat box, hopefully now. Please download that, and if you'd like one. If you're having any trouble with that, again, reach out to us and we'll be sure to send that to you in an email. Please take a moment to complete our evaluation survey. The link is being posted in the chat. And it will be emailed to you again with all those resources that we talked about. So thank you all so much for your time. We really take your feedback seriously. We want to make sure that we give you the best information that we can. So please do that survey for us. And again, if there's any support that we can be for you, please don't hesitate to reach out to you. We offer all sorts of different training and technical assistance, and we're excited to continue the work and continue this conversation about enhancing parenting time and really using that information to inform the reunification process. So thank you all. Thank you especially to our panelists, but thank you all for participating today.
Thank you.